Hey, everybody, this is Jason Wilson. Thanks for tuning in to the Curious About Cannabis podcast once again. Today, I am joined with Janna Champagne, a good friend of mine and nurse working in the cannabis space. Thanks so much for coming on the podcast.
Oh, thanks for having me, Jason. I'm excited.
Yeah, totally. So let's kick this off right away with a simple question. What's a cannabis nurse?
Oh, great question. You'd be surprised at the various responses I get when I tell people what I do for a living. And yes, I'm a cannabis nurse, and so what I do is a lot of different roles. The main one that is my bread and butter is working directly with individual patients to assess their considerations of cannabis therapy and create a targeted care plan to help optimize their cannabis therapy outcomes.
Okay, so from what I'm familiar with some of your work is a lot of your work with patients is really centered around like integrated medicine, like lifestyle management, that sort of thing too, not just cannabis. Is that right?
Absolutely. And myself and my nurses that work with me through my nonprofit Integrated Holistic Care, we all take more of a holistic approach. So we talk to the patient not only about the cannabis considerations, like, what are their diagnoses, what are their symptoms, what are their priorities, but also we get into diet and lifestyle and stress management and those sorts of factors. And so, we try to educate. That's our role, is to educate patients on how they might improve their health overall.
That's really cool because that's becoming a theme with almost everybody that I've interviewed so far. Is usually the discussion ends up getting into thinking about health and wellness from a broader perspective than we're sort of conventionally trained to think about it, I guess. It's so common for people to just think about health as, well, I live the way I want until I'm sick, and then I take medicine, I get better, and then I live the way I want again.
Right.
And I'm hearing this echoed more and more that, no, you've really got to take a step back and look at your lifestyle and how that's affecting your body and how that all works together. So that's great to hear. That's really, really good work. And it seems like the healthcare industry broadly is kind of seems to be lagging behind a little bit. Like they're getting there. They seem to be more and more accepting of that concept and that idea. But it still seems like there's a little ways to go before it's.
Yes. It's actually improving, and especially here in Oregon. I mean, we're so spoiled. It flows so freely, and pretty much anybody that needs it can access it. So we're very fortunate that way. But it's our healthcare system is broken. The pharmaceutical paradigm is not curative in any way, shape, or form, with the exception of possibly like antibiotics and surgeries and things like that. But when it comes to the actual medications, it's like putting a Band-Aid on something that's infected, and the underlying issue is not getting any better.
Yeah.
So once you start explaining to people that the way cannabis works is different, it actually is targeting those underlying imbalances in the body that are creating illness and creating the symptoms. And so it's a very different approach. So a lot of doctors don't understand that. I haven't met a physician yet who learned anything in medical school about the endocannabinoid system, for example. It's not taught even to this day, even though, we've had legal cannabis in Oregon for 20 years, and California even longer.
Well, and it blows my mind because, like endocannabinoids, it fits so perfectly into like the icosanoid category of like inflammatory signaling and all these different things that fit into what doctors are theoretically learning about in medical school, and yet this whole lipid signaling system that we call the endocannabinoid system is just largely absent, which it's been really disappointing to me too. It's been really hard to find healthcare professionals I can talk to in any sort of sophisticated way about cannabinoid stuff. And even a lot of doctors and nurses that I know of that are even working with patients still are operating from a very, very, very basic understanding. Like they've just learned, that there are CB1, CB2 receptors, and they've just, just started to understand all these pieces. So that's one reason why I'm really excited to talk to you today, because you've got so much experience working with different patients, and it seems like you're part of a network of healthcare professionals that are trying to work with cannabis and patients that are trying to understand cannabinoid therapies.
Absolutely. It's catching on. And, it is difficult. There's a lot of stigma to overcome. There's a lot of fear to overcome. But, once you start looking at the facts and realize that cannabis is a vital nutrient that keeps our body in balance. It's actually preventative for a lot of chronic illness. And we know that endocannabinoid deficiency or lack of cannabinoids in our body is linked with every chronic illness per Dr. Ethan Russo.
Yeah.
So it's, when people start to understand how it works differently from the pharmaceuticals, beyond that, if somebody is resistant to the knowledge, I often wonder if, they're gaining some benefit from pharmaceutical sales or something of that nature, because cannabis is the number one alternative to all pharma, in my opinion. I have dozens of patients that have reduced their reliance on pharmaceuticals or been able to wean completely. And of course, we prefer physician oversight with that piece. As nurses, we can't advise about that piece, but it is possible. And so I think that's some of the resistance we're getting from our medical industry that is so pharmaceutical driven.
Well, I in an interview I was doing with a health and wellness educator, that's a good friend of mine, Matt Vogel, we ended up talking about how we've noticed that a lot of doctors and nurses are sort of exiting the traditional healthcare model to get into working with cannabis because they feel like they're finally able to do some of the work that they actually signed up to do in the first place, which is work closely with patients and try to understand what's going on, try to improve quality of life and all of that they were kind of bound for one reason or another before. It's really interesting to watch, and it's an interesting sort of commentary on our healthcare system.
Well, yeah, and just the legalities, where it's so easily accessible here in Oregon, someplace like Idaho, they don't even allow CBD in Idaho legally, quote unquote,
Yeah.
So it's, depending on where they are, that can have a lot to do with different concerns around advising a patient to try it or what it might do for them.
Right. Yeah. Because, I'm originally from Mississippi and there is a CBD law in Mississippi now. From what I hear, it's challenging for people to get into that program. But the last time I visited back home, I spoke with a nurse there that told me like the dispensaries are starting to get going, but they're being run, through the hospitals, these CBD dispensaries, but they are starting to connect with patients, but it's really slow and not really like it should be and not what people expected when they got that law passed. So now they're trying to get signatures to get a medical cannabis initiative on the ballot for this year. And they're pretty close.
That's awesome.
I'm excited to see it because I believe, just from talking to people in Mississippi, I think that if it does get on the ballot, it'll probably pass because there's a lot of support just broadly for medical access to cannabis.
Yeah, absolutely. As long as you're staying here in Oregon.
Right. Yeah. Right. Yeah. I wouldn't mind going back to do some consulting or help people get some businesses going, but I think I'll be in Oregon forever.
Yeah. Oh, that's great. It's great here.
So let's talk about some of the types of patients and the types of conditions that you're seeing that people are trying to treat with cannabis. What are some of the most common conditions that you see that people are, we'll start with successfully treating, and then later I'd like to talk about the things that seem to be, that cannabis doesn't seem to work so well for.
Okay. So we see a variety of patients, and it's myself and a couple of other nurses in my organization, and we have a variety of backgrounds. So, this is nice because we can typically understand a patient's situation regardless of what they might be going through. For instance, my areas of specialty tend to be pediatrics and autism. I have a daughter with autism, autoimmune, mental health, neuro. That's sort of my acute care and nursing background is in those areas. I have my nurse Jen, who's on staff, and her specialties are oncology and gerontology and hospice. And then I have another nurse that just came on, and she's a cardiac nurse, and she also has some mental health background.
Oh, wow. So you're pretty balanced.
And we're continuing to try to find more specialties. There's still areas like women's health and other areas where we see patients come in and, we're having to do a lot of research and we don't have the background. So we're still looking for more nurses to kind of fill in. But, we have a large variety of patients for that reason. My largest population is children with autism.
Okay.
Probably hands down. A lot of autoimmune, a lot of, just inflammatory pain syndromes. I've seen it work beautifully for opioid reduction. In fact, I'm collaborating now with a physician in North Carolina who has a pain clinic and trying to help target his clients and what might work best for them, for CBD only, of course.
Yeah.
But, there's just so many things that it can be utilized for. And it was so funny. I had a consultation with a retired pharmacist, and you could tell he was questioning the science, and I was sticking to the research.
Yeah. Well, that's good. Yeah.
And he was saying, Janna, I just don't understand how one thing can be good for so many different conditions. And this is the shift that needs to happen. And, pharmacists and doctors are used to pharmaceuticals that have one or two active ingredients.
Right.
Where we have the cannabis plant that has upwards of 500,
if not
therapeutic
thousands,
components that we know of.
Mm-hmm.
We're finding more all the time.
Yeah.
And so this explains, the way that it works is to promote balance in the body. The underlying cause of every chronic illness is underlying imbalances. So in a general way, you can see how it's going to come in and kind of promote wellness overall. So it's very different. And cancer, we've seen cancer patients that are in stage 4 on hospice, not eating. Of course, we encourage patients to please reach out to us before cannabis is their last resort. But, we have seen some miraculous recoveries from cancer, patients who graduated from hospice. On hospice, we typically talk about, well, let's try to promote appetite, so at least you're not starving to death from the cancer and the cachexia piece. But, we always warn, if you're really intent on letting go and passing, this could extend your life. And, one of the best cases was lung cancer patient and on hospice, starving to death, took cannabis just to eat. And 6-7 years later, he's still alive and well and cancer-free.
Wow.
So we do have those instances, but once again, it's not to encourage people that, they can try everything else first and then bring in the cannabis. Because we also know by research that cannabis improves the efficacy of chemotherapy.
Right.
It's protective against the effects of radiation and against the symptoms that we often see as side effect of chemotherapy, where they lose their hunger, they can't eat, they don't have the energy to get well. So it just works on so many different levels for people.
Yeah, and something that I've talked to some people before about that challenge of like, how can cannabis treat so many things? And something that I point out is, you've got cancer and all these other different things, but so many things are related, interconnected, and the inflammation piece and the immune system. I mean, because inflammation is a process that the immune system uses to deal with a stressor of some sort or another. And when you look at how cannabis affects inflammation and immune system response, that just trickles out into so many things.
Absolutely.
That to me, that starts to answer that question pretty clearly. It's like, well, when you do look at the underlying causes of so many chronic conditions, it tends to be immune system related and inflammation related in some form or another.
Absolutely.
And, definitely there are things outside of that, but that's what relates a lot of things together from what I've seen.
Absolutely. Absolutely. It's great for that. And, in my own case, the reason I became a cannabis nurse was my own health failure back in 2012. And it was immune related. And I was very, very sick and non-functional and on disability. I was a critical care nurse doing acute care 12 hours a day, working my graduate program, homeschooling my daughter with autism. I mean, there were some other factors like stress involved.
Oh, my gosh.
But I turned to cannabis as an alternative to opioid pain medications after totaling my car. And knowing as a nurse, you've seen these long-term opioid patients and what they go through, and their gut stops working and they have tubes everywhere and they're either awake and screaming pain or completely sedated and out and nothing in between. And, that's not anything anyone would wish for. Yeah. So, but in addition to managing my pain, the cannabis actually started to rebuild my immune system. Wow. And now I'm healthy, fairly healthy, and functional anyway. I mean, I was non-functional, bedbound for a long time. People don't understand how sick I was. I mean, I was 20 pounds lighter than I am now. Wow. I was very, very ill. Chronic renal failure, and just all my systems were not handling the stress very well.
Well, yeah, it's definitely something I wouldn't guess by looking at you.
Yeah,
that it was,
most
got
people
to that
wouldn't.
serious point.
Yeah, and then it went on to help my daughter with autism. A couple of years later, she went into autism puberty crisis, high level behaviors. as a homeschooling mom, out of home placement was not something I ever would have considered, but it was almost mandated because of safety issues.
Wow.
And cannabis spared her that. So now I actually have a plan in the next year. She's 17 now, and working on a model of cannabis care homes for autism here in Oregon.
Wow, that's really exciting.
I just talked to my specialist yesterday about it, and we're moving forward. So super exciting.
That's going to be, we'll have to do a follow-up once you get, over the next year or two and kind of follow how that goes. That'll be really interesting. That'll be an interesting case study.
Oh, yeah. We can do better. With the same funding, we can do so much better.
Yeah. Do you mind speaking a bit about how cannabis helped your daughter and how what you tend to see in other autistic children as well that seem to be getting relief? I think that's something that is, people hear about the cancer piece and inflammation, all that, but I don't think the autism piece people broadly hear about very much.
Yeah, it's definitely catching on. I mean, the autism community of parents is fairly close-knit.
Yeah.
If somebody goes on a website or a blog and says something works, you can see sales of it just spike. I mean, everybody is desperate for answers because mainstream medicine is really failing these kids. They're falling through the cracks.
Yeah.
They're throwing, unresearched pharmaceuticals, for mental health at these kids.
Just shotgun approach. Just throwing it at the wall, see what sticks.
And we don't know what the long-term effects of those are. Even the side effects we know of, like the extrapyramidal symptoms, are just devastating and can be permanent. Even if you stop the medication, these symptoms can go on with tics and all kinds of problems. So there's really no good answers. And so from the research I've done with autism as a nurse with a child of autism, I see it as a multisystemic disorder, and this is part of why mainstream's falling apart trying to take care of it, because they don't look at how the systems are interconnected. And with autism, it's neurological, it's gut, and it's immune system, and how those systems interact with one another.
Yeah.
And so if you're not looking at how, when one goes askew, what happens to the other, you really miss a lot of opportunity to target those underlying imbalances.
Yeah.
And pharmaceuticals aren't going to do it. They just aren't. Where cannabis has the potential to be neuroprotective, balance the neurotransmitters that are out of place, decrease the brain inflammation that we see as a hallmark of autism, and high glutamate levels, for example. It's immune modulating. So if that child's immune system is deficient, it's going to help improve it. If it's overreactive, autoimmune, it's going to help, kind of bring it down a notch or two. And then gut. I mean, it's great for gut healing and gut inflammation. So it's really kind of targeting those core areas of autism that need it. As far as protocols, we take an individual approach.
Yeah.
Every child with autism is different. Even if they're similar, they're different. And so I tend to look at what are those child's needs, and there's really no, this is what you do for autism. It's what are the symptoms? What are the targets? What are the parents' priority? If that family is in crisis and that child is beating everybody up and self-injurious and destroying their home, they don't want to hear about, this might help balance their system. They want to know, what can I give my child in that hard moment that will stop those behaviors in its track? Yeah. So sometimes that answer is THC, even though we're really cautious in always balancing the risk and benefit of using THC in children because, research supports that it can cause neurodevelopmental issues. Right. Yeah. So, it's always about targeting what we see as the major issue, and which component is best for that is going to differ based on that child's situation, based on where the family is located, based on the legalities. There's just so many factors that come into play.
Yeah, well, it's good to hear you say that, because floating around on the internet, there are so many simplified explanations of, how to use cannabis therapeutically, and, these sort of DIY models of, you just take, X amount of, this, chemical profile, or worse than that, just saying a strain name. Just find this strain name. That drives me crazy, because I'm like, well, there's so many layers of why that's bad. But, I mean, with medicine broadly, it is so much of an individualized thing. And, the piece about THC is interesting. It's like, well, there are some risks with administering THC. However, it's about the situation and how critical is that situation. Absolutely. And what are the risks if you don't? Right. And what's, what's going to happen, and weighing those options. I've run into that concept in other scenarios, friends that are resistant to different types of medical treatments. And it's like, well, what's your situation and what's going to happen if you don't? I know you may not like it, but it's about quality of life and all these different pieces.
Well, and a lot of parents want to keep their children in home. And if they're at crisis levels, their kid is making a lot of noise, the neighbors are calling the cops, CPS gets involved. I mean, there's all kinds of curveballs that can happen in that scenario. So if you can manage behaviors, get that family out of crisis, then they can kind of take a breath, take a step back, and start looking at other things they might do to help their child. Because they don't want to hear about diet, and they don't want to hear about, some of these other alternatives for autism. They want to know, what can I do right now to calm down my child and get out of this crisis? Yeah. And that's not the time to teach about things like genetic assessment and how you can, you can delve a little deeper into that and target some of the contributors. Right. So it's just about meeting the patients where they're at. And really the general protocols are like the Rick Simpson oil protocol for cancer. Don't ever do that. Anybody, please call a medical professional. Taking 500 milligrams a day of THC if you're on immunotherapy could stop the activity of the immunotherapy and totally cancel it out. So there are considerations in everybody's individual situation. What medications are they taking? What symptoms are they targeting? There's general recommendations around autism and CBD, and for some kids, CBD is great. For other kids, CBD is really horrific and will actually increase behaviors.
Well, yeah,
so you can't just randomly follow what somebody types online.
Right, and what works for one person won't necessarily work for someone else. A lot of the research around epilepsy and CBD as well as THC has shown that, in about a third of patients, it works really well. And in about another third or so, it doesn't seem to do much. And for another third, it exacerbates the problem. Yeah. And, and trying to understand that it's with cannabis, just like anything else, it's not a cure-all, and everyone's different.
Absolutely.
Every situation's unique, which segues into what I think does not get talked about enough, which is through your experience, what does cannabis tend to not work so well for? And then to piggyback on that, I'd also like to talk about interactions with medications and that sort of thing.
Yeah, so cannabis can definitely interact with meds. That's one of the big areas we assess with patients. In fact, we have a list of criteria on our website under the FAQ that it kind of guides patients through a questionnaire. Do you have a cardiac condition? Do you have cancer? Do you have diabetes? Is it for a child or adolescent? Do you want an individualized approach? Things like that, where they should seek medical oversight of their cannabis therapy. And pharmaceutical interactions are probably the big one that could potentially cause harm. And I know that is such an unpopular message, but I've seen some close calls. I've seen some near misses. And I'm telling you, in a perfect storm scenario, somebody could get harmed. And then the reputation of cannabis as a safe medication goes out the window.
Right.
So we're trying to prevent that. We're also trying to, of course, we want to protect patients as well. I had an 80-something-year-old woman with chronic pain in Michigan, and she went into a dispensary, which she called a health clinic. She thought she was getting medical advice. Yeah. And, for chronic pain, never used cannabis. She was taking metoprolol, which interacts with THC in a way that can cause somebody to think they're having a heart attack, and they end up in the ER.
Yeah.
This bud tender sold her a 300 milligram THC candy bar. But don't worry, he told her to only eat half.
Oh my gosh,
this poor woman
150 milligrams.
Was high for days, and thank God she happened to space it away from her medications, or that could have been a real problem. So, and that's just, a medication interaction, but then you have other interactions with like chemotherapies where combined with CBD, it can expedite liver failure.
Yeah.
So, there's definitely reasons to seek medical oversight, when those conditions are present.
And what would be your advice to someone that does not have access to a healthcare professional that understands cannabis very well or cannabinoid treatments? What would be your recommendation to them on how they should talk to their healthcare professional, especially in the context of CBD, because that today is going to be probably more prevalent than anything, since the CBD market's just exploding and the regulatory oversight's kind of weird on it.
And CBD has the most interactions with pharmaceuticals.
Right, and the way it affects the liver. Yeah,
if you're taking warfarin and you combine it with CBD, it's going to increase the efficacy of the warfarin, and you can see where internal bleeding could be a potential side effect of that. So, So we serve patients all over the world.
Mm-hmm.
We have patients in every state of the U.S. and internationally. So we're always available to help patients if they have questions. We have a lot of information on the website, and we work with a lot of doctors. If the doctor has questions, we want them involved. We want them asking. And outreach to doctors and other nurses is a big part of what we've begun doing. And I am a founding member of Cannabis Nurses Network, and we do a lot of nursing education and continuing education units. And so this is how we're going to reach more patients, is by teaching the medical professionals.
Yeah.
Because I can tell you, as one nurse, the need is so profound. It's more than any one person can do.
Yeah.
So we're really trying to bring together these groups of like-minded nurses and medical professionals that are willing to be warriors for this plant and really stand up against the stigma and educate. Educate. It's so
well, that's why I'm doing this podcast.
Absolutely.
It's like,
Thank
you. Trying to get these critical conversations going. And I really emphasize the word critical because, my intention is to try to talk to people that understand some of the nuance behind all of the stuff, and that it's not straightforward. It's not a cure-all. There are all these considerations.
Absolutely.
And however, understanding those considerations, cannabis can be very safe for most people in most scenarios, and can be a tool for people to try. And I try to say, everything is a tool in the tool chest, and cannabis is another tool as well.
It is. Absolutely.
And for some people, it's a very powerful tool, and for other people, not so much. And and that's fine. That's just the way it is.
Yeah, and so this is why we have the questionnaire so we can guide patients that might benefit from a consult. But we also have a patient handbook for those patients that say no to all those self-questionnaire inquiries. And with the handbook, they can pretty much get through on their own and manage and learn the general information that we normally teach during a consultation.
Yeah.
And so we really try to reach the patient regardless of whether they're going to come and do a full consultation.
Right.
Our goal is to educate. And, we educate freely as much as we can. We do a lot of presentations, and we speak at conferences, just getting the word out and sometimes just planting that seed. I don't know. I find that even the most closed off people tend to come around once they see the benefit of cannabis in themselves or a loved one. And then it's like, whoa, hey, there's something to this. And then they start researching and they see, wow, it doesn't really belong on Schedule 1. It meets 0 of the criteria.
Right,
Why is it on there? And, back in the 80s, we had a DEA judge say cannabis should be removed from Schedule 1. And here we are 30 years later.
Yep.
They fired that judge, brought in another one and overturned it immediately.
Yep.
Oh, and then they went and applied for the government patent for cannabis as medicine, 6630507. So there's just so much hypocrisy and so much obvious focus on choosing profit over patients. And, as medical professionals, we take oaths saying we will do what's best for the patients. We will teach the patients, how to weigh the benefit or the risk of any intervention. And 9 times out of 10, cannabis is that answer.
Well, yeah. And it's, so the Hippocratic Oath, that's an interesting thing to bring up because from what I'm learning, it's like a lot of healthcare professionals have their hands tied behind their backs because of things like insurance companies, different agreements with pharmaceutical companies, ethics boards, all sorts of different things that seem to be stripping the autonomy away from healthcare professionals. And like, oh, well, even if I think that cannabis might be a good tool to try, I can't take the risk of presenting that to my patient because then I might lose my license or, I might not, a lot of healthcare professionals are basically leasing space at hospitals and different hospitals moving around. It's like, well, that hospital might not let me work there anymore. There's all these different pieces that are motivating healthcare professionals to kind of clam up and keep working within, the system as is. And, I don't blame them for being extremely cautious and conservative. However, the education piece is critical, and that Hippocratic Oath, I think that's the biggest piece of like we need to look at things that are keeping healthcare professionals from upholding the oath they took to take care of people. Because if something's getting in the way of that, then that's a huge, huge problem.
It is. And it's fear. It's fear is
Yeah.
the biggest hurdle to cannabis. Fear of the stigma, fear of the propaganda, you
Yeah.
know, the reefer madness that everybody was subjected to back in the 50s. When realistically, if you look at the history, cannabis was used as our medicine
Mm-hmm.
in cultures around the world for thousands of years, safely
Yeah.
across the lifespan, from infancy to end of life, everything in between, for dozens of disorders.
In our pharmacopoeia for up until the 40s.
Mm-hmm.
I think it was like 42,
Mhm.
that issue when it was finally taken out, after Anslinger's business in the 30s.
Mhm.
And that's something that a lot of people don't realize. Like, old school pharmacies sold cannabis tinctures
They did.
and, you know, and various preparations of cannabis. And it was called cannabis. It wasn't called marijuana.
Right.
Um,
Yeah, marijuana is the term that was meant to increase the stigma against Mexican Americans, Mary and Juan.
Yeah. And it's, you know, there's debate now in the industry. I try to stay away from the term marijuana altogether.
Yes.
There are some people fighting to like reclaim the term, and if they want to do that, that's fine. But to me, and even the term hemp, I don't like the term hemp either. It's like, this is all one plant.
Mm-hmm.
Like, let's just talk about what it is. It's cannabis, and there are THC-rich versions and CBD-rich versions and different growth forms. And, you know, it's a highly variable plant, which is really, really cool. It's really interesting.
It's just amazing how many things it produces. And, you know, when you look at 1937, too, when they took cannabis basically off of the market by taxing the heck out of it, the AMA was against it.
Yeah.
They were dead set against it. And a lot of physicians didn't know what was happening because they called it the Marijuana Tax Act and they knew it as cannabis. So a lot of physicians found out after the fact and they're like, what the heck did they just do? Like, this is bad. So, I mean, historically, our physicians knew how important it was. And they were fooled. They were lied to, and they were, I can't think of that term. They were punked.
They were. And now there's been such a generational gap from people that were alive then when all of that happened, that now very few people understand what actually happened when that change occurred, and they just assume that, like, oh, well, cannabis has been a drug that has been a problem for a long time, and we got to be careful about cannabis abuse. And of course, you do have to be careful about the abuse of anything, including food.
Oh, yeah. Well, yeah.
And that's something in some of these interviews I try to get into, is harm reduction pieces too.
Absolutely.
And maybe that's something we can talk about. So one piece, let's have a pretend scenario. Someone has decided to try cannabis. They're using a THC-rich version, and they get uncomfortably high. What can they do?
Oh, gosh, so many things. One of the easiest things is, hopefully, if they have cannabis products, they've got some high CBD, something or other on hand. And CBD will actually counteract that intoxicating effect of THC. They can chew black peppercorns. There's some products on the market, one called Undo, that actually it cleans the CB1 receptor. And so, I mean, there's lots of different things we can do. But basically, we try to teach patients how to start slowly, increase slowly, approach it conservatively, so that they don't get into a scenario where they overdose. And, we also teach that overdose may be very uncomfortable, and I've experienced it myself. My first time making edibles, I had the decimal point one space over, and instead of 10 milligrams per brownie, they were 100 milligrams per brownie.
Oh my gosh.
My husband ate 3 of them and was high for days. I ate 1 and vomiting and vertigo and crawling into bed, hoping I would wake up the next morning. Of course I did. So while it can be really unpleasant, it's not something that is like the opioids, where if you overdose on pain medications, it'll stop your breathing. Right. Cannabis is a lot safer that way. But we try to teach patients how to avoid that scenario to begin with. So.
Yeah. That's I think it's called the start low and go slow model.
Absolutely. And with things like cancer, we have patients working up to fairly intensive dosing, sometimes several hundred milligrams a day of cannabinoids. But usually if you titrate slowly, they can manage that intoxicating piece and let their body build up tolerance over time and really avoid a lot of that unpleasantness. And then, I mean, like with autism, I have kids managing on 2 milligrams a day and kids that require 200 milligrams a day and everything in between.
Yeah.
And very rarely do the parents report intoxication because these kids are at such a severe endocannabinoid deficiency.
Mm-hmm.
It's just filling in that hole.
Well,
so they don't even get enough to get that intoxicating effect.
That's actually really interesting to hear, because that's something I've experienced personally. People I know that can use THC-rich cannabis and seem to experience no
Functional
sign
impairment.
of behavioral change,
Right.
really. Yeah,
Right.
they kind of maintain being what most people call normal,
Mm-hmm.
whereas other people are super sensitive in the smallest amount, and they're hyper paranoid, and really can't function. So that's an interesting
Genetics.
piece to recognize, is
Right.
that there are some people that cannabis just affects very, very differently than others.
Absolutely. And it goes back to genetics, and that's another area I specialize in. It's not exactly cannabis related, but you can actually look at somebody's genetic profile and kind of determine which components of cannabis might be optimal, which ones might be problematic. The only hard known contraindication to THC is a genetic mutation called AKT1, and it's associated with schizophrenia. And it's theorized that if somebody with AKT1 homozygous mutation takes too much THC, it could actually trigger schizophrenia or trigger a psychotic break. So, you're always wanting to look at what does that patient need, and the just the potential of using genetics and nutrigenomics to guide cannabis therapy is so exciting to me. I'm a total cannabis nerd.
The genetic testing stuff in general, I know it still has a ways to go as far as technology and everything, but that is the future of medicine, is
Absolutely.
being able to narrow in on potential best treatments from the get-go without having to bombard somebody with all sorts of different drugs to find out what works.
Right.
My personal experience, when I was a teenager, I had several different accidents where I hurt my spine and cracked my tailbone. I've got 3 different bulging discs, and then I've actually got cysts along my spinal cord too. So a lot of back pain, a lot of spinal pain, nerve pain in general. And when I was in my early 20s, I was seeing a doctor about it, and they put me through some pretty intense drug trials to try to find something that would work. And it was traumatic. I went through using off-label antidepressants to try to treat it, steroids, muscle relaxers, all sorts of different things. And just going through those trials of like spending a couple of weeks taking a drug, trying to see if it works, titrating off, going on something else. There were 2 or 3 months of my life where I felt like my body and mind were just twisted because it was like I was just getting beaten up, especially with the steroids. That was really rough.
And those are awful. They'll melt your internal organs with long-term use.
Yeah.
Not pleasant.
Well, and it's one of those things. It's like, why am I even trying this if I can't take it long-term?
Right.
And it's like well known that you can't take steroids chronically, although some people do. I have friends and family that for certain immunological conditions are taking steroids chronically.
Cannabis is the better option.
Yeah.
It's safer, and it balances the immune system without destroying tissue.
Yeah, and creating a dependency for other things to counteract all of those side effects. But yeah, I have a lot of empathy now for other people that go through similar drug trials, and any tool, technology like genetic testing that can help narrow down some of that and avoid people having to go through that would be great. I have a really good friend of mine that was diagnosed with schizophrenia, also went through all sorts of drug trials, experienced one of the side effects he experienced from one of the medications is a tic that won't go away. It's permanent now. And he's not taking that drug anymore. It didn't work well enough. He had to come off of it, but he's stuck with a neurological side effect, theoretically forever.
Potentially amino acid repletion. I've seen that reverse extrapyramidal symptoms that were thought to be permanent. It had been ongoing 10 years. So There are some options.
That's good.
There
Good
are
to
some
know.
options.
I'll have to have him listen to
Yeah,
listen
have
to
him
this.
call me.
Yeah.
Give him my number.
Right. Yeah.
But no, I mean, they have like the gene site testing that they're using to specifically look at mental health medications. But all it's really assessing is like some of the neurotransmitter pathways and how that medication metabolizes. So looking at the different liver pathways
Yeah.
and trying to use that to pinpoint which medication might be best. And, I have a case study that's local here, a boy with autism and schizophrenia both. Went through a pretty severe crisis recently, and they exhausted that list of potentially helpful medications for him.
Yeah.
And we did his genetics, and we got him on some supplementation, and we got him on CBD, which CBD is perfectly fine to take with schizophrenia. It's just that THC piece that we're careful about.
Yeah.
And he's doing better now than he was on any of the meds ever.
Wow.
He's got quality of life. His family's out of crisis. He's able to enjoy his siblings, and he's got a little baby niece. So I mean, it's just amazing the difference that the approach can make. The
little things that a lot of people take for granted, of being able to just enjoy being present with your loved ones.
Absolutely.
That there are a lot of people around us every day that don't have that luxury, that, are always fighting a crisis.
Yeah. And it's the patient stories that keep me going. I mean, there's a lot of gray area being a nurse in this industry. And even though it's patient education and we're careful to cite research for everything we teach, there's a lot of nurses that are too afraid to do this work.
Oh, yeah.
And I only know about a dozen of us that are actually doing clinical application of cannabis therapy. There's a lot of nurses that know the theory and they know the endocannabinoid system science. But when it comes to learning the considerations and learning what to ask patients in different scenarios, we don't have a program to teach that.
Well, and there's so much, too, that's undocumented as given some of the limitations of research of just what patient outcomes are.
Absolutely.
And so having that firsthand experience is, the only way you're going to learn some of that nuance of how people are going to likely respond to treatment. And that lets you know things to look out for, warning signs that, may come up during treatments. And
what to teach the patient to watch for.
Yeah.
If a patient's on hypertension medications and they want to try CBD for pain, we still teach, watch your blood pressure, take it every day. If it's low, don't take one or the other, and document it for your physician and start talking to them about, I'm taking this and it's lowering my blood pressure. Can we start to wean off the pharma?
Yeah.
So, I mean, we do a lot of that, that this is possible. And we really try to come up with all the possibilities, as scary as they might be. We try to teach, like, some people that take THC with melatonin end up with hallucinations, but there are products on the market that combine THC and melatonin. So I know it's not everybody,
well,
but we still teach that. So the patient, they're not surprised by it.
Yeah. A paper just came out recently. I don't know if you saw it, but melatonin was found in cannabis.
Oh, I did not know
Cannabis
that.
actually makes melatonin.
I wonder what level, though.
I know. I'm sure
maybe it's like the higher doses of melatonin or something.
Oh, I'm sure. I'm sure it's low dose, but it was just fascinating to me. I was like, oh, okay.
Yeah.
I wonder what plants using melatonin for.
Yeah, and melatonin works crosses over some of the mechanism of action with CBD. They both increase serotonin. So, I mean, those parts of it are okay, and I don't even have a theory on why THC and melatonin causes hallucinations, but it seems prevalent in autism responses. Well, which of course most parents with autism are using melatonin because it's protective of the brain.
Yeah.
So.
Well, I know just from personal experience, melatonin can trigger some pretty wicked lucid dreams.
Oh yeah, it increases REM for sure.
Yeah. A very, very vivid dreams.
Yes.
That can be really, really intense. So maybe and then THC disrupts REM. And so I've got
it's that battle.
Yeah, I know.
Them.
Yeah,
good
maybe
theory,
there's.
Jason. I like it.
There we go. Put my stamp on it. Figured it out.
We got it. To be on a fly on the wall in our conversations, right?
But it's interesting. There's got to be something going on in that tug of war, and it's there's so many tug of wars happening when you consume cannabis or any sort of medicinal plant with a broad phytochemistry that it's hard to really figure out exactly what's going on. I had a really good conversation with Dr. Kevin Spellman recently about this, and he was talking about how really when it comes to cannabis research, we need to focus on patient outcomes and stop worrying so much about mechanisms. Because, it's like you have to understand some mechanisms for sure. But if you get too caught up in the allure of understanding exactly what's going on before being willing to try something, then you're potentially limiting yourself permanently, because some of these interactions are so complex, we will not understand them within our lifetimes in any, really sophisticated way that's going to allow us to predict, really, perfectly what's going to happen, given whatever scenario that someone tries something.
Well, yeah. And how many pharmaceuticals do we have that we use and we know the outcomes, but we have no clue how they work?
Right.
We don't know the mechanism of action. I heard that over and over in my pharmacology classes.
Right.
So, that makes sense. I don't know. Maybe I'm a little more optimistic, but I agree with you. We're very much in our infancy in this industry, and our knowledge of the plant. We've been stunted thanks to almost a century of prohibition.
Oh, yeah.
And, what I tell people is if anybody proclaims to know everything, back away slowly, maintain eye contact, and say goodbye, because that person's going to be obsolete very quickly. Yeah. Because we're learning more every day.
Oh, yeah. Yeah. Just our concept of what the endocannabinoid system is changing rapidly as far as the different types of receptors that we're considering part of the endocannabinoid system. it's way beyond CB1 and CB2 now. You've got the vanillin receptors. You've got
the G protein.
Yeah, unnamed G protein coupled receptors that just have numbers associated with them, 18 and 35 and 55, all these different ones. You've got PPAR gamma receptors, adenosine receptors, even serotonin receptors. We're finding that a lot of receptors appear alongside cannabinoid receptors, and that they're influencing each other, right next to each other on these cell walls. Serotonin's a great example.
Oh, yes.
A lot of times you'll find serotonin receptors and CB1 receptors right next to each other. So it's just getting more and more complex, but it's just highlighting just how intimate the endocannabinoid system is woven into our physiology.
It's connected to everything, and knowing the genetic piece and the cannabinoid pathway genetics, it crosses over the neurotransmitters, it crosses over the vitamin D pathway and the GC-MAF pathway of the immune system. It gut pathways, the FET2 pathway. I mean, those are all linked with the endocannabinoid system. And, once again, this is where we're failing in mainstream medicine, is we're not looking at the body as a whole. We're looking at it as, if you have a neurological problem, you go to the neurologist, and he wants to stay in the little neuro box. If you have a GI problem, you go to the gastroenterologist, and they want to stay in their GI box. And the immunologist wants to stay in his immunology box. Everything's connected, people. And we need to start looking at how those connections impact overall health. And that's when we'll finally be on to some more curative approaches in our healthcare system.
Yeah, something I've gotten into before, but it's, thinking about the human body as a system, an ecosystem, a network of ecosystems, really. And my original background in science is biology and ecology, and it's all translated so well into pharmacology.
It is.
Because I'm already primed to think about, like, okay, there's sort of this fractal nature of systems. You've got this ecosystem, and then when you focus on a piece of that, there's another system that's part of that, and more systems. And if you tweak things here or there, you're going to have unintended consequences on other things. You've got cascading effects that happen, and it's very clear that the human body is the same way. And going back to something you mentioned about autism, with the link between mental health, gut health, the immune system, that's coming up. There's been some newer research that's come up about schizophrenia that's shown the exact same thing.
Absolutely.
That the gut is influencing, the mental health.
And brain inflammation too.
Yeah, and through immune system responses and inflammation and all of that. And that it's this cycle and system that's happening. And if you're just trying to treat the neurological piece and you're not treating the gut health piece, the inflammation piece, and all these others, then you're fighting kind of a, not necessarily a losing battle, but a very, very difficult battle to win if you're not, taking those other pieces into account.
And there's actually a diet, it's called Gut and Psychology Syndrome, or GAPS diet, that has shown some great promise, actually reversing symptoms of schizophrenia and bipolar, borderline, some of the big ones. just by healing the gut,
Yeah.
by changing the diet, by cleaning it up. So,
Yeah.
I mean, it's all connected. And I've even heard things like leaky gut syndrome means leaky blood-brain barrier. So they're very closely connected. I think there's two closely connected systems in the body, to be honest. And then, of course, 70 to 80% of the immune system resides in the gut. So there's that connection.
Yeah. It's like just that little piece.
Yeah, no big deal.
Yeah, right. Yeah. Just ignore it most of the time, but
And I think most autism begins in the gut.
Yeah.
So it begins with gut impact.
Yeah. Well, it'll be interesting to see how science progresses in that regard, because autism is one of those things that it's sort of going through such an overhaul in how it's characterized.
Absolutely.
And bipolar is also like that. I mean, a lot of things. Fibromyalgia is another good example of
it's such spectrums of
exactly.
everything.
They are spectra, and they're not a single thing. And we have to be careful when we talk about medical conditions that we recognize that actually when we're using a single phrase to describe a condition, we're actually talking about like a whole host of whole spectrum of different symptom presentations and
absolutely
states of being.
Yeah, that individualized approach is so important. And, children with autism, I see some that are on the higher functioning and they have social anxiety.
Yeah.
Maybe some other difficulties with ADD, ADHD. Well, that approach is going to be probably CBD focused versus a child that is in full on crisis and they're self-injurious and they're biting themselves or they're smashing themselves in the head and having to wear a helmet, or, destroying the home, or they can't go out of their home because of their sensory defensive-ness and too much noise, too many crowds, too much light, and they melt down. So when we're looking for that sensory deafening, when we're looking for that piece, THC tends to work better. Self-injury, I translate that to mean pain. This child is in pain and they're, my daughter used to knuckle herself in the sternum till she bruised. And the sternum as a nurse is where we would rub a patient if they were unconscious to see if they were responsive to pain, because it's a very sensitive area.
Yeah.
And she would do that till she bruised. And I thought, gosh, why would somebody do that? And then here we are with the answer, endorphins.
Wow.
They're after their own body to release endorphins, which is the natural pain relief. So, and that has held true for so many of my clients. We get them on a good pain solution with some THCA and some THC, and the self-injurious behaviors recede.
Yeah.
So, it's really, the approach is very individualized for these kids.
And learning to read that language.
Absolutely.
That's a really interesting piece to bring up of, you have to figure out what's being communicated that can't be communicated directly.
And most of the kids with self-injurious behaviors are nonverbal or limited verbal. They can't express their needs. They can't tell you what's happening. And knowing most kids with autism have brain inflammation, can you imagine the headaches they must be having?
Yeah.
This explains why these kids are knuckling themselves in the head.
Yeah, just trying to get something to happen to change.
Yeah, there's some profound videos like on YouTube. If you look up the Zartler family, they have a daughter with autism and CP, and they're in Texas, and they've been using THC inhaled in a vapor machine for her. And it's the only thing that will stop her beating herself in the head.
Wow.
And you see the videos, you see her beating herself up, and they give her a puff off the vape, and then she's just calm and happy, and she's in her chair, and it's all good. So it's amazing what it can do for these kids and these families.
Yeah. Yeah, that's...
it's intense.
It is, yeah.
Every parent of a severe child with autism has PTSD, in my opinion. So
yeah, no,
the parents can benefit too.
Yeah. No, for sure. These are traumatic experiences for everyone involved and anybody that cares about that child, And even for people with different conditions that can verbalize what they're feeling, as humans, sometimes we're just not very good at knowing what we actually want or need, or, even with myself, like there are times, I'll feel a certain way and, my wife will ask me what's going on and be like, I don't know. I just know I feel this way and I'm too caught up in how I'm feeling to even think about why or what. And so it brings up an important piece of like mindfulness of trying to take a step back and try to observe and listen and interpret, try to make some sense of what's going on. think that sometimes that for families that are caught up in trying to take care of somebody that needs a lot of help, that it's also urgent and overwhelming, that it's really, really hard to be able to find that place of distance to try to evaluate what might be really going on and what someone might really need. Even just having an infant, I go through that on a regular basis of like, oh my gosh, like, why are you upset? Like,
behavior is communication. Remember that,
right,
Jason.
exactly.
Behavior is communication.
Yeah, it's like, you're crying. I fed you. I changed your diaper.
It shouldn't be punished.
Right.
It should be,
what do you
should
need?
attempt to understand.
Yeah, like, I want to make you happy.
3 a.m, it's not so easy, right?
Right, yeah. So coming back to cannabis, based on your experiences, what would you say are some of the top misconceptions that people have about cannabis or cannabinoids or the endocannabinoid system, whatever direction you want to go with that? What are some of the things you come across frequently?
Just breaking the stigma, unveiling the stigma. It's so profound, especially in certain generations like the baby boomers. Are one that are so resistant because that reefer madness mentality. They were told it would make you do evil things. They were told it meant you were a bad person and you would be sexually promiscuous in the age of squares. I mean, it was like the worst possible thing they could tell that generation. And thankfully, I'm seeing a lot of baby boomers call me.
Yeah.
And even that first step of saying, okay, I'm not sure this is what I want to pursue, but I just want more information.
Yeah, just want to learn.
Huge. Just that openness. And don't get me wrong, there's definitely, my family included, there are baby boomers that are still dead set against it. They won't look at the research. They don't want to hear the outcomes. In my case, cannabis, I credit it with saving my life, and it spared my daughter out of home placement. And my family still rejected our use of it. And of course, my dad was a minister turned prison guard, so that might have had something to do with it. But, most of the time when they see a positive benefit is when they finally start to go, wow, there might be something to this. And then you start teaching the facts and you start showing them the links of, the hypocrisy that's behind the cannabis prohibition and how, in my opinion, it's strictly in the interest of sparing the pharmaceutical profits. It's not in the best interest of patients. Yeah. And so, I know that cannabis has the capacity to revolutionize our healthcare system. But in order to do that, we need solid education. We need to start teaching it in medical schools, for one. We need the physicians to understand it. Yeah, that'd be a great start. Because sometimes we have patients go to the physician and the physician's like, oh, I can't do that. That's not going to help you. Yeah. At best, oftentimes they say, well, try it if you want, but don't talk to me about it, Yeah. So I think that's where it starts is making it an acceptable option for patients, helping them understand that risk versus benefit when you're looking at the pharmaceutical options or the more invasive options even versus the cannabis. And, why not try it? Most of the time, it's an acceptable option.
Well, yeah, that's a piece that I end up bringing up a lot is shouldn't the safety profile have value, when considering the treatment?
Absolutely.
And so often cannabis ends up being sort of at least these days, I think it will change, but it's so often a last resort option for a lot of people when, to me, that's super interesting because it's, granted, there are contraindications, there are limitations, there are things to be aware of to reduce harm and maximize safety. However, for most people, it is a very safe option compared to some of the potential outcomes from other therapies.
Absolutely.
And so the idea that it's a last resort just seems out of place. It's like, shouldn't it be tried out earlier?
Absolutely.
And if it doesn't work, then go to something more extreme rather than the opposite.
That's what we agree to in our medical oaths that we take
Right.
about patient care is that we will teach them the most conservative approach and we will teach them to weigh the risk versus benefit.
Do the least harm.
So they can make an informed decision about their own care and have that patient autonomy. And that's largely been stripped away.
Well, yeah. And something I brought up in a previous interview, but something that drives me crazy is direct-to-consumer drug advertising. And that patients are going in to see a doctor saying, I saw the ad on TV. I want to take this drug. And then the doctor is kind of, has to kind of go into this tug of war with a patient who has already decided what drug they want to take.
Yep.
And then there are a variety of other factors too that end up influencing that whole interaction between the doctor and the patient. But that's something that really bugs me. And there's only a couple of countries in the world that allow that direct consumer advertising of drugs.
Yeah.
And talking about, earlier we were talking about doctor autonomy, and now you're talking about patient autonomy. And if we want to try to improve the healthcare system rapidly, which I think it does need to happen rapidly. I think it's happening, but it's happening very, very slowly. But we need to focus on how do we enhance healthcare professional autonomy and patient autonomy and patient compliance with different therapies, not bailing on something too quickly or denying possible treatment options based on stigma and that sort of thing.
That's where education can help all of those areas you just mentioned. Doctor education, patient education, stigma education. And another big problem with the pharmaceutical commercials is, they're running on these media outlets that also give us our news.
Yeah.
And so, we see a lot of instances where something big will happen with a pharmaceutical company and, a medication is black boxed. And when you look a little deeper into that, you see the pharmaceutical companies are paying for the research. And if they don't get the research outcomes they want, they'll repeat it until they do.
Right.
And they may have done 10 studies and one of those had a nominal benefit and the rest had these really detrimental effects.
Yeah.
But they'll pick that one out to run it through FDA, hoping to get their profit back before it's black boxed.
Yeah.
And in the interim, people are getting killed. And a lot of that's not being covered by mainstream media because they don't want to jeopardize their advertising profits that are coming in from those commercials. So it's just a rampant issue. And until people start really standing up and saying, I'm going to boycott this channel because they have pharmaceutical commercials, it's not apt to change.
No, it's not. And it's a shame that it's not getting attention because there is a movement among scientists to get this data exposed. Oh, gosh, I can't remember where it was, but there was some company that made a really cool, it was almost like a game that you could play online that illustrated this concept. I'm going to have to dig it up and do a follow-up to this episode and tell people how to find it.
We'll have part 2.
I've totally forgotten about it, but now I'm remembering like, oh yeah, several years ago, I found this website where you could go through this little sort of interactive exercise where you're doing trials for some condition and you see the outcomes and you're narrowing your patient population that's going through the trials and you're excluding data until eventually you get to that data that works and gets you approval and everything. And it just highlights just how serious that problem is. And it's like, hey, this isn't just a game. This is what happens. This is well known among scientists. And it's a battle that some scientists that I know that work in, private industry, it's an ethical battle they have because a scientist will get a job at a company and the company's like, okay, I want to do clinical trials on whatever. And then they get wrapped up into this system where they want to do good scientific work. But then the company's like, well, no, we want to exclude people that have these conditions, exclude people that have this, exclude people that have that. Basically creating a sample population that does not represent the broad patient population at large. And then doing multiple studies, trying to find the data that works. Oh, shred that data, keep this data, whatever. And it really eats away at a lot of scientists. Eventually, they're just kind of like, well, this is just the game I have to play to have a job, to live. And so I understand that piece too, that it's not straightforward because a lot of these scientists are trying to live and trying to make a living. And I think some people have perceptions that scientists must be super wealthy and, top of the food chain. And it's like, no, that's not the case. It's extremely hard to find ways to do research, to find money, to, be able to do the type of work that we would like to do. And so the consequences, a lot of us end up working for private companies that have their own interests. And
you lose the objectivity, you lose the integrity. And not a lot of people understand what parameter to look for to determine if research outcomes being sold to them are valid.
Yeah.
So they don't catch those little details.
Right. I mean, it's extremely difficult, if it's even possible, to understand whether there's quote unquote dark data behind a clinical trial. And to balance this out too, just because research is funded by a private company, it doesn't mean it's bad research.
No.
Not
necessarily.
Yeah, it's just you have to be critical about everything. Is kind of what it boils down to.
There are companies that don't have patients' best interest in mind.
Exactly.
I'll leave it at that.
Yeah, exactly.
They have their profits in mind.
Yeah, and their shareholders.
And there's such an entanglement between the pharmaceutical companies and our politicians that they're protected.
Yeah.
They're protected. They're allowed to run amok and do things that are not in the best interest of patients.
And they have
as a healthcare professional, I have a big problem with that.
Yeah.
As a human, I have a big problem with that.
Right. Yeah. Exactly. Yeah. Well, so getting onto this concept of research and everything, and looping it back around to cannabis.
Sure.
What would you like to see? Something I ask every guest. What would you like to see from the future of cannabis research and cannabinoid research? Because it's picking up steam a lot. There's a lot of momentum behind cannabis research now, especially with the Farm Bill passing now. I think what a lot of people haven't realized is, while some people had a conception that the Farm Bill was going to legalize CBD, and it didn't quite do that. What it did do is it has made it where every university in the country now can touch cannabis and can start to do research. And I've been communicating with a couple different universities that are starting to try to launch pilot research programs with cannabis through hemp. And so, I mean, we're about to see a tidal wave of research coming in. That's really exciting. So what do you hope to see from the future of all of that?
Human trials.
Yeah.
I mean,
with the herb.
You can only transfer so much from mice trials to humans. So that's a big one, ensuring that the formulations of cannabis being used in this research is really optimal medicinally. I mean, we see a lot of research on the isolated components, and we know they work very differently. Yeah. And, of course, one of the big teaching items that I cover with my patients is how to find medical grade cannabis. And what we find is, the whole plant is what you want, especially for something like cancer. You want that entourage effect. You want that synergy between all of those components and the wisdom of nature. When we start isolating it and fragmenting it, and I like the term bastardizing the plant, we see bell curves in response where it works for a while, and then as you increase the dose, it stops working completely. We have some comparative studies that support that whole plant is just as effective at 20 to 25% of the dose of isolate. So when you're talking about cost savings for patients, that's an important piece.
Huge. Wow.
And so really, we need more whole plant research, and so that. That's a big project that's near and dear to my heart, as well as figuring out how can we promote that, or at least be comparing, the isolates with the whole plant so we can compare the outcomes. And I think that's going to be really important for ensuring that, patients really understand the difference between these formulations, and, where CO2 and isolates and things of that nature might be great for symptom management. I've got a headache. I'm going to take a hit off my vape pen. It's great. Quick relief. It's not going to give you that underlying balance that we're after with some of these sick patients. And if a patient's calling me, they're pretty sick. Yeah. I don't get patients calling me because they want to get intoxicated. They can usually handle that on their own. Yeah. These are patients that oftentimes cannabis is kind of their last resort and their last ditch effort to try to recover their health. And in those situations, like a patient with cancer should not be taking CO2 or isolate. They should be taking whole plant. They want that underlying balance. They want, as much strength as they can get from that formulation. Yeah. So, and all I've done in this industry is follow the need. And that's a need that I saw in my patient outcomes with different products and started researching. There's an article that summarizes our criteria that we use to vet suppliers. We don't benefit from the sales of any product, but we vet suppliers to determine who we'll refer our patients to. And it's flow. Yeah. It's flower derived, lab tested, organic, and whole plant. You'd be surprised how hard it is to find suppliers that meet those criteria. There's a lot of CO2. There's a lot of fancy marketing. There's a lot of fear about ethanol extractions, and how alcohol is bad for you. They're basically lying and not explaining that they purge the alcohol and ethanol extractions. Right. So they are safe. There's no ethanol left, ideally, and lab testing would show if there was. So, I mean, it's a big need, and it came from patients calling me, and sometimes they've spent thousands of dollars on product that they got from a friend of a friend. They don't know what it was. They don't know the strain. It wasn't lab tested. They don't know how it was made. And, it could be toxic. It could make their situation worse. So we hate having to say, you might have wasted your money because we can't condone the use of that product.
Right, yeah. Well, and even with ethanol extracts, or let me say alcohol extracts, because there are some people that are making alcohol extracts with isopropyl alcohol, and then some people that are using food-grade ethanol and other forms like that. And so, it's those nuances that's important for consumers to understand, that all these extracts are different. I'm working on making some YouTube videos right now about this issue and about the term full spectrum.
Yes.
And how I would love to see that term just like disappear completely, because it's just a marketing term that's just been used every way a company can figure out how to use it.
Yes.
And consumers just really have to focus on, like, ideally, can I see the test results? Can I see what cannabinoids are actually in this, in the extract that's in this product? Can I see results about terpenes? And I wish there were easier ways to get data about other compounds in cannabis, but right now that's where we're at. Cannabinoids and terpenes is about the only data you'll really be able to consistently get. But
it's very deceptive, because full spectrum makes you think that broad spectrum of those 500 therapeutic components in the flower are in this formulation, when realistically it's oftentimes an isolate plus a few terpenes thrown back in.
Or distillate.
So a dozen compounds versus upwards of 500 possible. Which one is really full spectrum?
Right, yeah.
Not the one with a dozen. And that's what they're calling it.
And when you just see these products on a shelf and you just see full spectrum and there's no description, because in typical herbalism, you list the plant that you extracted, and you list what parts of the plant were extracted, and oftentimes you'll also list the in some generic terminology what type of extraction was done, and that at least allows a consumer to say, oh, for instance, if it was a cannabis product that was labeled correctly, oh, this was a cannabis extract made from ethanol. Oh, and they used flowers and leaves and roots and, all these different pieces, or, they used the flower, or, whatever.
Right.
And to have a better understanding of the differences. But right now, all these products look the same.
Right.
And they're not. And
exactly.
That's a big concern I have.
Huge.
Just especially with CBD, because it's in every state, basically. There are some states cracking down on it that are starting to go around and confiscate CBD products.
Wow. Some of them should be confiscated.
Yeah.
Some of them should not be on the shelf for sale.
Yeah.
Not all products are created equal.
Yeah, and there is some good role the FDA does serve sometimes with trying to ensure, that manufacturing operations meet some basic minimum industry standards. And so many of these CBD products are far, far, far from bare minimum quality standards.
We're very careful to teach patients, if it says industrial hemp, question it.
Right. What does that
their
mean?
Raw material?
Yeah.
If they could have raw material that's hemp stalks out of Chernobyl, they could be full of radiation, and we're not testing for that. So,
or it's just like seeds that have been ground and milled and extracted.
Or biomass. I mean, you want flower derived. Flower is where all of the good stuff is made. That's what we want in our medicine.
Yeah, for sure. And before we wrap things up, one thing I wanted to talk about before and forgot until right now, and this is all bringing it back to the surface.
Sure.
Different types of cannabis products. When you're working with patients, what are the different methods of administration that you commonly see? What tends to work better for different scenarios? Because you mentioned taking a hit off a vape pen might help some pain or headache or something, but I imagine when you're working with patients with much deeper issues, you're probably getting into things like edibles and tinctures and other administration methods, sublingual.
Right.
Can you comment on that?
Yeah, my favorite, especially for patients just starting out, oftentimes they're brand new to cannabis. They've never tried it before. The sublinguals are great, the tinctures, because you can literally count the drop and know how many milligrams you're taking. It's easy to exactly titrate. Some of our patients that have higher dosage needs will graduate to Rick Simpson oil or FICO. We call it full extract cannabis oil.
Yeah.
Which is it's super concentrated and it's almost a tar-like consistency, making it very difficult to dose. And like the Rick Simpson protocol says, take a grain.
A rice grain
rice.
size.
Well,
yeah.
there's all kinds of different types of rice, and who might, if you do short grain rice, it's probably going to be about half the amount as long grain rice.
Is it a swollen piece of rice that's absorbed water? Or?
Right. As a nurse, I like accurate dosing. So we tend to go with tinctures. We tend to start off with sublinguals with the goal of getting a patient on a baseline support protocol where they're taking it 2 or 3 times a day, either sublingually or, if they don't like the taste or they want that longer effect of the liver metabolism, they can put it in a capsule and swallow it. And so it just depends on the situation. Inhalants are great for quick onset. My daughter, her behaviors are stabilized and manageable. The exceptions still probably being PMS week is still where we kind of duck and cover. And so we've learned, we know her little signs that she's starting to ramp up to her full tilt behavior, which, these days is full tilt behavior is maybe 10 minutes, where back in 2013, 2014, gosh, sometimes she'd go on for 2 or 3 hours and literally rage until she was physically exhausted and she would pass out. So you notice the difference. It's not perfect. I never say it's perfect. But, when she's starting to ramp up, she'll actually ask for her straw, which is her code word for vape pen. That's how we taught her to use it. It was suck on it like a straw. If she asks for her straw, we go running for it because we know that's at 10 seconds. It's going to calm her immediately, and hopefully, she'll do a 180 and never hit that full tilt behavior where she's out of control and needing time out and, kicking the doors and the walls and all that. So, it just depends on the situation. It really does. We tend not to do a lot of edibles. Not initially anyway, just because it's so easy to take too much and then you're stuck with it for 6 to 8 hours on average, sometimes longer depending on that person's genetics and their liver metabolism pathways. So we tend to not go there. Topicals are great. Topicals are great, especially for, quick relief of pain. I have a pain topical I use a lot, but those are kind of the main ones.
Yeah.
And we like ethanol, food grade ethanol extractions. Isopropyl alcohol makes me a little nervous, especially with these big producers. They're not testing every batch. And if there's some iso left in there, it could make a patient really sick. Yeah. So we tend to not opt for anything that could be a risk factor when possible.
Yeah. So for me, I work with a lot of companies trying to get them GMP compliant to prepare for FDA compliance. And a big piece of that is trying to make sure all of your component ingredients are food safe.
Right.
And while there is some room for using ingredients that aren't, if you're going to purge them out, have them removed, improve that and everything, it's just a better situation altogether to just use food grade ethanol.
I agree.
And isopropyl alcohol, I have concerns in general, having seen a variety of product manufacturing facilities. I have very big concerns about worker safety and how they're making these huge batches of extracts and being exposed to fumes, whether from ethanol or isopropyl alcohol. Right. But the isopropyl alcohol piece bothers me a little bit more. And I don't know if that's because of my own ignorance. I genuinely just don't know a lot about the safety of isopropyl alcohol in those sort of industrial applications. I've used it, in the lab to do analytical extractions, that sort of thing, before, where I'm exposed to very little amounts of it. But I just genuinely don't know what the risks are of being exposed to large quantities of it.
It's toxic.
There's
no way around it. And ethanol in its way is toxic as well, but at least if it's food grade, it's not going to poison somebody like isopropyl will.
Yeah. And then your body can deal with it a little more easily.
Absolutely. So, and a lot of people that do the food grade ethanol extractions, and maybe ISO too, they're using a distiller. So it's reclaiming the spent alcohol, cleaning it out. It's just an amazing process. I'm sure you've seen it, but you soak the plant matter in food grade alcohol, and then you strain it out, and the alcohol is green.
Yeah.
And then when it comes back out of the distiller, it's clear again, and it's stronger.
Right.
And you can use it on the next batch, so it's cost saving too.
Yeah, exactly.
And there are some little at-home ethanol extractors that have good seals on them, and it's reducing people blowing up their garages and things like that, like we've seen here recently.
Yeah, it's, from my experience, it seems like the stories of people, causing explosions in their homes from ethanol extractions, or like BHO and PHO, butane and propane hash oil and everything. That seems to be going down. Hopefully people are getting a little smarter about that. And hopefully people just don't need to do it at home. Like they have access to stuff. They can figure that out, at least in some states. Yeah.
So another good take home on that piece, if somebody hears RSO, Rick Simpson oil, you want to ask, what is that solvent? Because he recommends things like acetone and isopropyl alcohol and naphtha, things that are very toxic. And especially if a patient's trying to do it themselves, that's high risk.
Yeah.
Very high risk. So, I've used food grade alcohol forever. And recently I even upgraded to organic 190 proof alcohol, just to get away from that GMO substrate of Everclear. Yeah. And so, I think as we learn better, we do better is kind of the take home there. But be careful. Be careful.
That's kind of the overriding message of our whole conversation. More education, better behavior.
Absolutely.
Things get better overall. So
absolutely.
Well, you've been super generous with your time. I think we've gone almost an hour and a half. That's great.
Yeah, we could talk all day.
Oh yeah, I'm sure we'll sit down again and talk more. I definitely want to hear more about a variety of different things that you're working on. I want to catch back up and see how it's going and what you've learned.
Absolutely.
Anyway, thanks so much for coming on the podcast and talking. And I want to give you a moment just to let people that are listening know, first of all, know that this interview will probably come out a few months after we're recording it. That being said, if you want to share with listeners ways that they can learn about some of the things you've talked about, finding that handbook, the Nurses Approved program, all that sort of stuff that you're doing, if you want to just let them know how to find you and that sort of thing.
Yeah, so I'm online at integratedholisticcare.com. That's the nonprofit where we offer consultations, and there's blogs and articles on there, a couple of that I've referenced today. The one on the flow criteria and making sure your cannabis is optimal medical quality. There's, my daughter's story, which is here. It featured on the front cover of a nationwide magazine a couple of years ago. That was kind of my coming out of the cannabis closet moment. So there's a lot on there about autism and CBD for autism and why that could be problematic for some kids. I'm also founder of the Cannabis Nurse Approved program. It's a very new business, just launched in April. But this is our project to try to highlight medical quality producers that are meeting those flow criteria so that we can refer patients in good faith and know that it's really an optimal company and medicine for them. As far as getting in contact through either of the websites, I just got confirmed as a speaker at the Cannabis Science Conference coming up in Portland in September. So I don't know if this will air by then, but that's another potential time to connect. If you're there, come by and say hi.
Great.
So yeah.
Awesome. Well, that sounds wonderful. I have to check all of that out. Thank you all for listening to this conversation. I'm sure we'll have more very soon. If you want to find more information about the Curious About Cannabis podcast, you can check out cacpodcast.com, and there'll be some extra content there. I want to get some of the resources that you and I have talked about on this podcast and off the podcast. I want to get some links on the podcast website to refer people to some of that. And as always, you can connect with Curious About Cannabis on Instagram, Facebook, or Twitter. On Instagram, we're at Curious About Cannabis. On Facebook, we're at Curious About C, because you cannot say cannabis in your names on Facebook, which is funny since Facebook owns Instagram.
So good luck finding me under Cannabis Nurse Janna then.
Right. And then on Twitter, we're at About Cannabis. And then we're also on YouTube now as well. So you can search for the Curious About Cannabis YouTube channel, where we'll have excerpts from some of these interviews on there, as well as additional educational videos that I'll be working on producing and putting up there. And if you like what you hear and you like what we're doing here, consider becoming a member on the Natural Learning Enterprises Patreon at patreon.com/Natural Learning Enterprises. Thanks so much for listening, and I'll talk to you soon. Thanks, and take it easy. Bye.